Hi, I'm Dr. Jenna Sopfe, Assistant Professor of Pediatrics here at Children's Hospital Colorado. I'm a pediatric oncologist in the Center for Cancer and Blood Disorders, and I'm a specialist on our Helping Oncology Patients Excel, HOPE, Survivorship team. Our multidisciplinary survivorship program cares for a wide range of children and young adults who have survived cancer or undergone a bone marrow transplant, including for non-malignant diseases. Today, I will be discussing an often unrecognized and unmet need of many of our adolescent and young adult cancer survivors, sexual and reproductive health, and in particular, sexual dysfunction. Each survivor of childhood cancer is at risk for a unique set of potential late effects depending on their cancer, treatment, age at diagnosis, and other factors. Further, these risks can change as patients age, reach life milestones, or develop other risk factors. Because survivorship needs and risks are complex and ever-changing, a longitudinal, comprehensive approach to survivorship care is critical. Sexual and reproductive health is an area that can be affected in numerous ways, particularly necessitating multidisciplinary care. For example, cancer and its treatments may result in challenges with infertility, hormone function both before and after puberty, maternal-fetal complications, and sexual function. While the first three are well recognized by pediatric oncologists, primary care physicians, endocrinologists, and fertility specialists as complications of pediatric cancer, the fourth, sexual function, is not. Sexual function concerns occur in between 20 and 50% of childhood cancer survivors. Provider awareness and proactive surveillance for sexual dysfunction is critical because many patients may be unaware of their risks or uncomfortable bringing up such a sensitive topic to their providers. For this reason, I have focused my research efforts in this video on this topic. Sexual function encompasses physical, emotional, mental, and social well-being when it comes to sexuality and sexual activities. In our patients, some concerns include decreased interest or drive, decreased physical arousal, decreased satisfaction, changes with orgasm, anxiety or worry about sex, and pain with sex. Childhood cancer survivors are at risk for these issues as a result of physical and psychological effects of cancer and its treatments, such as chemotherapy, radiation, and surgery. As you might expect, problems with sexual function can have serious effects on patient quality of life, including bodily pain, general health, vitality, social functioning, energy and fatigue, physical quality of life, and mental health. While interpreting the association between sexual dysfunction and quality of life is challenging because they are interlinked and may have causality in both directions, several studies demonstrate that addressing sexual dysfunction actually results in decreased psychological distress overall. There are many potential reasons for challenges related to sexual function in childhood cancer survivors, and often the pathophysiology is multifactorial. For example, some studies demonstrate that alkylator chemotherapy is a risk factor for sexual dysfunction, possibly related to its effects on hormone function. Similarly, radiation to the pelvis not only causes commonly recognized late effects such as risk to fertility and hormone production, but can also be associated with concerns that may arise as patients mature, such as erectile dysfunction, vaginal scarring, shortening or dryness, and decreased blood flow. Cranial radiation can affect sex hormone production as well as normal psychosexual development. Central nervous system, spinal, and pelvic surgery can also affect sexual health and function through nerve disruption and other causes. Just as these effects can be detrimental to physical health and reproductive ability, they can have profound impacts on mental health and quality of life. Beyond these physiologic effects, experiencing childhood cancer, even in the absence of specific risk factors, can be disruptive to normal childhood and adolescent development, including psychosexual development. Childhood cancer survivors can also experience challenges related to forming romantic relationships, body image, and other related concerns that may in turn affect sexual function. As I mentioned before, sexual function can be an uncomfortable topic, and while research shows that adolescent and young adult survivors want help for sexual function concerns, they need their providers to broach the topic proactively. Unfortunately, research also shows that many providers have discomfort with discussing sexual function, leading to this need being unmet. Improving our survivorship-focused care for sexual health and function is my area of survivorship expertise and research. Because sexual function is a sensitive topic that many people have difficulty talking about, we as providers collectively need to learn how to initiate ongoing communication so that we can take the best care of our patients. To this end, my research aims to actively develop a more adolescent-friendly approach to discussing sexual function with patients. Specifically, we are using direct patient and provider input to address barriers, ultimately aiming to create an evidence-based way to facilitate communication through the use of a screening tool. Our screening approach will be tested for effectiveness and usability in a real-world clinical trial across multiple hospitals. An improved approach to sexual health communication can then be expanded to increase communication around other sensitive or difficult topics. And our hope is that our novel communication tactics will be used around the world to improve survivorship care. Now, turning back to patient care. Once sexual function concerns are identified, it is important to work with specialists, such as our fertility preservation and reproductive late effects team, gynecology, endocrinology, urology, psychology, and sexual function experts to develop an age-appropriate, multidisciplinary approach to addressing each patient's concerns. Treatment may require hormone therapy, local vaginal therapy such as lubricants or dilators, education, cognitive behavioral therapy, sex therapy, or other approaches. This is just one example of the importance of patient-centered, multidisciplinary, and comprehensive survivorship care. Our HOPE survivorship program here at Children's Colorado is committed to working with patients and their doctors as a team, providing education and surveillance, serving as a sounding board when new concerns arise, and keeping up to date as new survivorship recommendations become available. Thank you for taking the time to hear about the importance of sexual health care in cancer survivorship. For more information on our survivorship program, please contact us or visit our website.